it's in the breaking we come unbound. And it's in the giving we are found. Yeah, you could barely change.
Welcome to A Medicinal Mind, Wisdom and Well-Being, a podcast dedicated to the telling of authentic stories and the sharing of insightful wisdom, exploring science and spirituality, medicine and Mother Nature. No topic is off limits when it comes to growing our personal understanding and supporting our collective well-being. With your host, Dr. Rob Abbott, a family medicine resident practicing spiritually focused and evolutionarily informed functional medicine, we hope to nourish your being so that you can flourish in whatever the moment has called for you to do.
And I know you tried.
In episode 29 of A Medicinal Mind, Wisdom and Well-Being, I explore the field of naturopathic medicine with the founder and editor of Naturopathic Pediatrics, Dr. Erika Krumbeck. Dr. Krumbeck received her doctorate of naturopathic medicine from Bastyr University and is a licensed physician in the state of Montana, working in her medical clinic in Missoula at Montana Whole Health. Integrating her experiences from both conventional and naturopathic medicine, Dr. Krumbeck specializes in the treatment of chronic health conditions in children. However, she recognizes and deeply appreciates that the best healing can only occur when the whole family is involved. In this conversation, Dr. Krumbeck starts by sharing her unique path to come to naturopathic medicine in the first place, literally coming back full circle to her childhood home to pursue her dream of helping others heal. Dr. Krumbeck then provides us with her definition of naturopathic medicine, outlining the foundational therapeutic approach, as well as her beautiful contrast of allopathic and naturopathic remedies versus allopathic and naturopathic clinical approaches. We then dig into the world of psychological and behavioral health in our children, seeking to demystify and clarify what really is ADHD. Asking such questions as, how should we approach kids and families struggling with behavioral and learning issues? Is it simply a psychological condition, or are there underlying physiologic disturbances, biochemical imbalances, and nutritional deficiencies manifesting in impaired cognitive functioning and emotion regulation? Is there a green vegetable deficiency? Are probiotics and fish oil the answer? And where does the family dynamic and parental relationship fit into this story? How about technology or social media? Dr. Krumbeck offers her practical approach for introducing and improving dietary intake in children, as well as describing her process for assisting parents dedicated to holding supportive spaces for curiosity and relational growth, focusing on the creation of healthy and nourishing boundaries. While I may not have kids of my own, I was blown away by Dr. Krumbeck's practical wisdom for helping kids grow, and this episode is packed with insights and passionate joy from a clinician dedicated to healing the entire family unit. Please explore Dr. Krumbeck's page at Naturopathic Pediatrics and see for yourself the wealth of educational resources created by Dr. Krumbeck and her amazing team of clinicians, just simply trying to improve the health of your children and our collective family. We will certainly have Dr. Krumbeck back on the show to explore more of her clinical approach to helping children heal, grow, and flourish. Now, let's dig into the show. Well, Dr. Krumbeck, thank you so much for joining me today for a podcast.
Thanks for having me.
I have so many questions to ask you, and I know we're going to just have to have a few of these conversations to get through everything that is really important to share. But please, let's start with just hearing a little bit about your personal story and how you got into medicine in the first place.
Yeah, so it depends on how far back you want to go. So strangely enough, when I was a kid, I wanted to be an acupuncturist, which I don't know why that was. That was just for a little while. In college, I was, did the kind of pre-med thing, but I actually was a double major in art and biology. And I, for a long time in school, wanted to be a medical illustrator. And so that was the reason for the double degree. It really wasn't until I think maybe somewhere halfway through school that I realized I didn't want to do medical illustration because they basically only spend their time either in the morgue or like in the ER. So
those are like both of my favorite places to hang out.
The morgue, yeah. I want to work with people. I love seeing people face to face, and I've always loved airports and hospitals. I just like the energy, and I like being around people, and I like seeing people's lives and people's stories. So I was that. I basically was pre-med. After school, I did a really short stint with AmeriCorps in Nashville. It was supposed to be a health corps is what it was called, an AmeriCorps program. It didn't last very long. I had a terrible experience. And I basically gave up on the thought of doing medicine because it was bad. It was one of those health clinics where kind of like everything and nothing gets done at the same time. And I thought I was done. So when I spent 2 years in Nashville, while I was there, my folks are from Seattle, and my dad had a stroke. One of the years that I was there, and I went back to visit him, and he did the conventional care thing, and he was doing physical therapy, and he was doing rehab and all these things, and at some point he plateaued. And of course, with insurance, when you plateau and you're no longer seeing real gains, then they kind of kick you off of services. So
Yeah.
He couldn't do long-term PT anymore, and my parents basically ended up trying any type of alternative medicine to get him better, which actually at the time did not really include naturopathic medicine, but he was doing acupuncture and Feldenkrais therapy. I don't know if you know what that is, but and that was helping him a lot. I don't know how much the acupuncture helped, but the Feldenkrais definitely was for a long time, and he did that for years. So the long and the short of the story is I sort of stumbled into naturopathic medicine. I was visiting my parents back in Seattle on a trip just to, check in on my dad. And I went with him to an acupuncture appointment, and his acupuncturist had graduated from Bastyr. And my dad wanted me to move home.
Yeah.
So he wanted me to enroll in Bastyr and said, you should go, to get me home. And Bastyr is like right behind my parents' house. It's so funny. So I grew up, I went to elementary school where I ended up going to graduate school, which was really strange too. So
everything comes back.
Weird, right?
That's circles.
Yeah, it was a little too much of a circle for me. So I went to check out the school, and I kind of fell in love with the school before I really knew what I was getting into. Most of the time they warn you going to naturopathic medical school, like you need to have quite a bit of experience in like dipping your feet into natural medicine and into healthcare, of course, but they really want you to know what naturopathic medicine is before you dive in. And truthfully, I kind of didn't. I had great grades. I was pre-med. I studied with all my friends who ended up in medical school anyways. So and I had this like little bit of experience. So I kind of got into Bastyr without having as much experience in naturopathic medicine as some of my friends did. So for some people that doesn't work out well because they don't know what they're getting into, but for me it did. And when I started school, I really felt like every quarter, every semester I was there, every class I took, I really feel like I fell more in love with the medicine the longer I was there. So I loved the basic course requirements. I loved anatomy and physiology, but when we started talking about herbs and nutrition and especially like biochemistry, I love that stuff. It's like the geekiest of geek brain food. So so that's kind of how I stumbled into it. And I sort of stumbled into pediatrics too. I really wanted to do more like psychiatric type stuff. And for a while there, I was working with some homeless folks. And I thought, like, wouldn't it be awesome to use naturopathic medicine to help heal people so they don't have to be on psych meds? And so that's kind of where I thought I was going. And I ended up stumbling into peds instead. And I think, one of the families in the clinic said, you'd be great at working with kids. And that just kind of stuck. And so I kept going. And then of course I had my own kids, and that changes everything. So that's how I ended up doing pediatric care, which was not what I was expecting to do. So.
Wow. I'm a sucker for these beautiful stories, and maybe at the beginning, as a little elementary age kid, you didn't realize where you'd be putting down roots and coming back to, I almost, I interviewed at a residency program about 10 minutes from my parents, and, joked with them that I would be coming back to, live in my old room and go start my residency. But, it's amazing how these journeys and these stories unfold. And there's so many things that I resonate with from hearing that. Obviously, I kind of share the biochemistry, geeky side of things, but I too really am passionate about sort of psychiatric care, and even more specifically, the pediatric population. It's something I just feel like isn't getting enough attention that it really deserves. Going forward, I see this is the future. Obviously kids are our future, but we need to really put more of our time into nurturing and supporting our children. And the statistics that are coming out, they don't lie. The rates of obesity and diabetes at such young ages, it's terrifying. And the statistics about projections of life expectancy for this generation as compared to our generation, it's terrifying to me. And we need to do something differently to help our kids grow. And then throw on top of that all of this technology and social media. We're facing things that our kids are facing things nowadays that just didn't exist when my parents and grandparents, and even to some degree when I was growing up, that just wasn't there. So there's so many new variables at play, and we need a new approach. We need to discover a new way to help nourish our kids, and that's why I wanted to have you on the show, because I stumbled across your work, your page, or your collection of work, and all of your colleagues from your clinic, and fell in love with your approach and your desire to help educate and really empower parents, and through that, children. And so wanted to at least start by getting your definition of what really is naturopathic medicine, and perhaps more specifically, what is your approach taking naturopathic medicine and applying it to the child and the family unit?
Yeah, boy. How do you summarize? Like, we've got our little elevator speech of, naturopathic medicine is differs from conventional medicine, and the principles of naturopathic medicine are blah, blah, blah. And it's like, I don't know, there's like long and short answers to that question. Like, the super short answer usually is, well, we use nature to heal people rather than drugs and surgeries. But that doesn't really do our medicine justice, I don't think, because really it's the approach that's completely different. So a naturopathic physician can use a drug naturopathically, and an allopathic physician can use something natural allopathically. So it really depends on how you're treating. The whole point of being a naturopathic physician, seeing patients in my office, at least kids who have complex medical conditions, is always to find the underlying cause, the root cause, true cause of what's going on. And so, some of the examples in conventional medicine have been, oh, well, you have acid reflux. Let's treat the acid because that's the cause of the reflux. And it's like, well, no, that's not the cause of the reflux. First of all, that's actually literally not the cause of the reflux because acid is normal. But the real question is, well, where did that come from in the first place, right? So I think the process of taking a case is what is really different from a naturopathic physician. And that's why, when we were talking about the differences of conventional medicine and how conventional medicine, maybe conventional med school needs to change, or naturopathic med school needs to change too, because there's definitely limitations in both. That I think that's the part that most conventional physicians don't understand, is just how different that approach is. One is it takes way more time than most conventional physicians have time for. But it really does take this understanding of biochemistry and going backwards in time and figuring out, kids' sensitivities and like you were talking about with screen times and all sorts of things. So yeah, I don't know. There's sort of the long and the short answer for all of those, but yeah.
No, I really like that answer. And I mean, your description of a naturopath using an allopathic drug naturopathically versus an allopath using a natural remedy allopathically, it's, just ringing with me here thinking, that's what I'm most afraid of when we start applying this term integrative medicine, as, is basically replacing a drug with a natural remedy, but still using it as a relative allopathic Band-Aid. And I think,
it won't work. And that's what people try to do. Yeah. And that's part of the problem with like this, that's why I wrote that essential oils blog post, which everybody hates. Like, don't just use an essential oil. I mean, that's what they hear is like, okay, you have a headache, use this essential oil for it.
Yes.
And I'm like, well, wait a second. Where is your headache coming from? You don't have an essential oil deficiency. What's going on? And so that's the stepping back in time. What is that root cause? And then one of the other main principles of naturopathic medicine is treat the whole person too. It really is just treat the whole, because when you're talking about kids, you have to treat that family dynamic too.
Yes.
That is what is absolutely most fundamental, because now we know that kids actually lay down their neuronal paths, those connections, in the context of having loving, safe relationships with their primary caregivers. And so it's so important for kids to have stable, loving relationships with their parents who are not completely AWOL and distracted by their phones at any given time. So I'm very worried about this upcoming generation, not because of what screens are doing to them directly, but because of what screens are doing to their parents, not having the time to make those connections with them. So that could be a whole podcast itself.
Well, I think let's just go there. I think, rather than make some other kind of segue, I would love to, let's dance in that space, because I mean, I think you hit on a huge point that once again, it can be easy to blame an object, a phone, a computer, technology in general, when actually what you're alluding to and what you're describing is what's deteriorating is the relationship, the connection, and what is the barrier is the technology, is the object, but the object itself is not really the problem. And so you have a wonderful handout on your webpage describing more broadly sort of behavioral issues in kids, and the wonderful term that wonderful label, as I see it, of ADHD that has become so widespread and just abused and used, I think, too jokingly in settings that it really should just, we need to find something better. But you have a wonderful handout that combines both sort of an educational process and guide for parents to engage with a provider to look for those root causes behind certain behavioral issues, certain psychosocial issues. And it combines the underlying physiologic disturbances that may be at play, the underlying biochemical, nutritional deficiencies that may be at play, with those relational aspects that become oftentimes overlooked, I think, sometimes in the most natural settings where it's all about the biochemistry or all about, well, your child's just not eating enough, they're eating Lunchables and things for lunch. Well, yeah, that's probably not a great thing, but perhaps we need to spend more time before going to bed reading a book. And really that's the deficiency, not the omega-3s. That was a little bit of a ramble, but anyway, wanted you to describe your approach to understanding behavioral disturbances and psychosocial issues in children, and if we want to use the label ADHD.
The number one thing that bugs me about ADHD treatment in the conventional world is not screening kids for iron deficiency first. It drives me absolutely, completely freaking bonkers.
Mm-hmm.
It bothers me to such a great degree that a physician would be willing to put a kid on Adderall or Strattera or whatever without checking to see if they have iron deficiency. It's so far beyond me. I mean, there's so many kids that simply need iron. And then the next step beyond that is usually some very, very basic balancing blood sugar. And so there's a great article that actually Dr. Maggie Luther wrote on our website, on the Naturopathic Pediatrics website, about balancing blood sugar in kids and improving behavior. And that can have huge benefits. So if you've got a kid, like I had a kid in my office earlier this week who every day eats a waffle with maple syrup on it. And I told the parents, I'm like, I'd be willing to bet you watch in 90 minutes after that breakfast, he's going to have a meltdown. I'll bet on it.
Yeah.
He's got a kid, nothing but carbohydrates plus simple carbohydrates, and he's going to have this huge insulin spike, shunt all of that glucose into his cells and then have a horrible reactive hypoglycemic episode 90 minutes later, and he's going to get grumpy at you. So don't be surprised when it happens, because that's just physiology. So those are the steps that really have to happen first. It's silly to put a kid on a stimulant medication when, they need to be eating some protein and fat for breakfast. So things like that bug me about our school system too. It's like, okay, kids, they've got ADHD, so let's put them on stimulants so that the teachers can be happier, when in reality they need to have better access to better nutrition. And, and then sometimes in the school system too, it's not that the kid has ADHD, they're just a kinesthetic learner, and the teacher has no idea how to deal with a kid that is a kinesthetic learner. So there's so many aspects to ADHD, and we're talking about learning management issues and behavior management issues in kids too. My other favorite one, which does not work very often, but when it does, it's just huge and life-changing, and that's just very simply turning off the Wi-Fi at night. We don't need Wi-Fi running at night anyways, and some kids just happen to be really sensitive to those EMFs. It's really probably only 1 in 20 kids, maybe less, but I've had kids in my office where they can actually tell when Wi-Fi is on in the home, and they'll tell their parents whether it's on or off, and they're correct. So that part kind of freaks me out a little bit, because we don't quite know, really. We say, well, science says it's safe, but I don't know. I start to think, like, do we really know? I mean, I'm sure our cells can sense changes like that. So that one's kind of interesting to me too.
No, it's good that you bring that up. And it's something I've been talking about with my friend Melanie. She's been seeing a couple patients who have this sort of perceived EMF sensitivity. And I can't even guarantee you that, they would be laughed at by some conventional doctors. And like, I just get curious. I say, well, I can't really explain this. How does this person, know? Like you just said, they'll literally know when, Wi-Fi is on and off with various symptoms. And and it'll disturb them. And, this clinical experience, it sounds like you've had with kids, making that simple change, something is obviously at play. To what degree it's affecting, a wider amount of people. There's probably some people with some degree of predisposition, and maybe we're going to eventually identify people who are more sensitive to these EMFs. But I agree in terms of like a simple solution. I mean, you're right. We don't need Wi-Fi at night. So let's turn off the Wi-Fi in our computers. Let's turn off the router. Let's just, unplug things and plug it back in the morning. And there's almost, I can't think of a harm to that besides you can't wake up in the middle of the night and get on Facebook. Well, I would love to get your, I know part of the approach we've talked about nutritionally and sort of developmentally in the school setting, trying to support kids. I know I see lots of kids who are bored in school, and like you sort of mentioned with this kinesthetic learning type, they get bored, and what do they want to do? They want to sort of move around, and we're kind of forcing them to sit in a seat. So, looking at these different approaches, what have you done in terms of entering the space of supplements or herbs when it comes to treating kids with ADHD or behavioral issues?
So interestingly, that's usually last. Well, it's sort of first and last, because I think that most kids can benefit from essential fatty acids and probiotics, particularly probiotics. Probiotics are, and just intestinal bacteria in general, is a realm that I'm super interested in. I really feel like the kids that are coming up now are sort of the first, people aren't going to agree with me, but they're kind of like the first post-antibiotic generation. So my generation, antibiotics have been around a lot longer, but in my generation, it became the norm to prescribe antibiotics for like everything. So when I was a kid, I had sinus infections every year and I had antibiotics every year. And that became commonplace, I think, in the 70s, 80s, and 90s or so. And so we've permanently changed our intestinal flora by doing that. And when we do, our children are actually inheriting our intestinal flora when we give birth to them, because that's what they get, not just from passing through the birth canal, but from having skin-to-skin contact with mom too. And they've really inherited, I think, abnormal intestinal flora, because there's none left of the good, diverse flora that there was supposed to be 100 years ago, or thousands of years ago as well. So that's a little bit disturbing to me. And I've seen clusters now in families where mom has IBS or something else. In the kids, you'll have one kid with Asperger's, one with constipation, one with food sensitivities or true food allergies, another one who has sensory processing disorder. I'm in Montana, so we've got big families over here.
Yeah.
And I have this several times where there's 4 kids in the family and they all have something related to digestive disorders, and they're presenting in different ways. Because a lot of these sensory processing kids really just have stomach aches, and nobody's really picking up on it, because if you have a stomach ache, what do? You're sensitive to everything because you already are in pain. So that happens a lot. And I see that a ton with ADHD too, where kids are misdiagnosed with ADHD. They're wiggling constantly. And the reason they're wiggling is not because they have ADHD, but because they have a headache or a stomach ache. So that's really common. So probiotics, I'm a big fan of. I know that in the conventional world, they're very hesitant for probiotics because the research is always mixed on what strain and what brand and what to get.
Yes.
And so I think that's a very tricky, because over-the-counter probiotics are notoriously unreliable. And in fact, Bastyr did do a study on this, and now it's probably been about 10 years, but they pulled over-the-counter probiotics and found that either most of them were dead or had the wrong strain of probiotic in it. Yeah. And so that's why it's really important to give professional grade brands of probiotics. And I wish that, I wish they were easier to access for everybody, but that's fish oil probiotics are the 2 number 1 most commonly prescribed supplements in my office. And they're like pretty basic, right? They're not, I'm not like changing brain chemistry. We're just giving kids what they need because they're not getting omega-3 fatty acids from our food supply anymore.
Mm-hmm.
So that's a big problem. And so I think we do need to supplement kids when they're inflamed and have abnormal intestinal flora. So that's like basic. I mean, there's so many things to do. And this is why you can't sit down and say, oh, ADHD kids need tyrosine, even though maybe 3 or 4 ADHD kids will improve with tyrosine. Like, what are you doing? You're just giving a precursor to epinephrine basically, and it's like pre-Ritalin. What's the point? That's not the point there. The point is to figure out what's really wrong. Very few kids are really deficient in that. Some are deficient in like methyl B vitamins because they're not eating any fruits and veggies at all. And that's really common with our beige syndrome kids that eat only beige colored foods.
Beige syndrome. That's an interesting term.
That's like my 2-year-old. He wants to have crackers and cheese, and I'm lucky because he'll eat oatmeal, and I'm lucky because he will eat broccoli, but like, oh, forbid me to put something else green on his plate. Just, like I'm poisoning him.
Wow.
So you gotta work around that, I mean, it's pretty funny. If you've got a toddler, there's always fights about stuff like that. So
yeah. Well, and that's where I think, trying to be, as a clinician, it's hard sometimes to have those conversations. I feel like with even, a degree of knowledge of nutritionally what I believe will be best for a parent's child, trying to meet that common ground of you're not going to be able to take a kid who just all they were eating was macaroni and cheese, chicken nuggets, and pizza, and the next day have them eating salmon, kale chips, and almonds. And what's that process look like in terms of integrating new foods, especially with, like you said, some of the kids with really difficult sensory processing disorders. You can't just shove new foods and essentially new stimuli in their face and expect it to go, over without any kind of hitch. And so I know I found that to be when the rubber really meets the road, the most difficult, challenging aspect is applying that knowledge of nutritionally what these kids need and being able to do it in a way that fits a parent's understanding, fits their budget, and they can incorporate into that child's lifestyle. And while, a lot of my peers need to be at step 1 in terms of getting that nutritional background, that knowledge of what the kids need, there's a lot of people too at where I think the stage I'm at where we need a lot more help and a support team of whether it's occupational therapists or some other individuals to help engage and be with the family. Because look, when you come to my clinic, I'm not going to be feeding you lunch. I can tell you what as a mom you can put in your kid's lunchbox, but I don't know how to really get your kid to eat it or to get that in your refrigerator in the first place. So was curious if you had some insight into how you navigate that relationship in space in terms of really getting kids and families to make those big changes.
Yeah, a couple of things. One, for sensory kids, having an occupational therapist on board is key. They need to be the ones doing the daily or at least weekly sensory type issues. And usually they're working on sensory issues that are not oral sensory, but I wish they would actually start there because that's going to be first. I mean, we've got to get good nutrition in these kids before their sensory processing issues go away, right?
Yeah.
So occupational therapists, if they're good, will work with kids on decreasing oral sensitivity. And so that's great. It's a very different story from kids who are truly autistic to kids who have sensory processing disorder. Because kids who have sensory processing, you can usually cognitively, they've got the faculties to understand. They might be mad, but at least you can verbalize what you're trying to do. And of course, that depends on the age access to fruits and vegetables and things like that. That's a whole nother discussion. And if I had a solution for that, then I don't know, I'd probably be in politics or be a gazillionaire. But that's a huge issue, and that's an issue that's much, much bigger than my role as a naturopathic physician, and that's one that we have to change. But in terms of supporting primary care docs in talking through this with families, in one sense, like, this is not rocket science. Half of the plate is fruits and vegetables. The other half, actually, I don't care that much, if the other half of your plate. So we talk about the My Plate guidelines now. Quarter of the plate is protein, quarter of the plate is whole grains, quarter is fruit, quarter is veggies. Harvard has the Harvard version of the My Plate guidelines. It's wonderful. I print it out for half of my patients. It's great. So I highly recommend printing that plate out and having parents stick it on their fridge. But I'll often describe to parents, I really don't care that much what's on the other half, what's on that half of the plate that has the protein and grains. So maybe you have mac and cheese on that of the plate. Okay, that's not quite as great as having brown rice and whatever, I don't know, like lean turkey. But the reality is we have to meet people where they're at, and you also have to meet kids where they're at and encourage them to try different foods. But I do try to insist that the other half of the plate is fruits and vegetables, even if the kids don't eat the vegetables. So in my office, I always say to the kids, like, okay, so Dr. K says it's okay to not like your veggies. And then they look at me like, what? I say, it's not okay to not try your veggies. So at least the rules are you got to taste them. You have to at least try, because you don't know what it's going to be like if you don't try it at all, right? So in the case of my little 2-year-old, we actually had this fight last night. He's picky. I thought my daughter was picky, but he's pretty darn picky. It's okay for you to send your kid to bed hungry, as long as they are going to have food, right? I mean, it's not okay to send your kid to bed hungry every day. But, we had food for him that I know he likes. He's just being 2 and he's stubborn. And thankfully he ate a couple bites of it. But if he doesn't like it, I'm sorry. This is what you get. Like, this is what we have. Mm-hmm. And you don't get to have chicken nuggets every day. I'm sorry. You just don't get that. So if you don't want it, you can be excused and run around and play. But when you get hungry later, this is what you get. Yeah. So parents don't want to be the bad guy, and I get it. But really, truthfully, and this is so important for parents to understand, the job of kids is to push your limits. And so as a parent, you feel like you're going nuts, but that's their job. The job of the parent is to form healthy boundaries, because kids who have boundaries feel more secure and they're more happy. And they don't feel deprived. They feel secure, and that's what they need for healthy brain development. So we have entered this age of permissive parenting, and I worry about it in some ways, because the research has shown that we're developing a generation of narcissists who think that they can get what they want at any given time. And that is not healthy, because we as parents know that they can't live to be healthy grown-up adults if they are literally only eating chicken nuggets every day. And I'm not saying that, we need to, I'm not saying we should punish our kids for not eating. That's not what it's about. That definitely creates disordered eating relationships. So if my kid doesn't want to eat, all right, okay, go for it. I'm not going to punish you for that, but this is what you get. So the next time that you're hungry, this is still the food that you're going to get. And again, in terms of like that permissive parenting, I'm not saying that we shouldn't be emotionally available for our children. That's not what I'm saying at all. Like, of course, we need to be there for them. We need to connect with them. But we don't need to be giving kids everything that they want at all times. So, yeah. So those I think are a couple of really important pieces. It's actually not that hard as a primary care doc to just talk families through that. And 2 other things I think are really important for that too. One is parents must be modeling good, healthy eating behaviors for kids.
Yes. Oh my goodness. Yes.
2, I guess I have 3 things. 2 is, so if kids see fruits and veggies on their plate every single day, even if they aren't eating all of them, they are going to have that mental model as they grow up that this is what a healthy plate looks like. And so as they grow up and become adults, they're more likely to have half their plate be fruits and vegetables and eat them as adults, which is really important. That's why kids, when they have a lunchbox, need to have fruits and veggies in their lunchbox, even if it comes home every day. So, you parents, you can eat it. You can eat their kind of semi-stale carrots so they don't go to waste. And I do sometimes, but they still be there. And the last thing, and this was a cool thing about research too, research shows that kids, two things. One, kids who have unfamiliar foods with familiar foods are more likely to eat them. And kids who are able to use dips are more likely to become vegetable eaters in the future. So I'll tell that to parents. I'm like, I really do not love ranch dressing. There's nothing nutritional value in ranch dressing. But if that's what you need to get your kid to eat veggies, research pretty clearly and strongly shows that if they get to dip veggies, eventually they'll learn to like the taste of the veggies by itself. So if that's what it takes, go for it. I'm all aboard. So that's great.
Wow, there's so many wonderful things in there that you've shared, and I'm glad that you put it in a very practical framework of what we can do as providers, tomorrow with our patients, with our parents. And to me, I'm so grateful for that. So thank you. And I will definitely check out Harvard's sort of version of the My Plate. One of the things I really resonated with in that answer, something I've talked with my girlfriend about quite a bit. She's in child psychiatry. Is we worry about the kids who aren't pushing the boundaries. I've it's like in my youth ministry with elementary age kids, and it's the kids who aren't trying to push the boundaries or push my buttons that day, or find out what they can get away with, that I sort of worry about what's going on. Like, why? Because exactly what you just said, they're looking for that engagement. They want to know that you care about them, and that they'll probably perceive that when they do something that they shouldn't have done, and you say, yeah, I think we went a little bit too far, and that you're protecting them, they feel appreciated, they feel loved, they feel protected. And so I completely agree that we need to be, as parents, being stewards of these children and creating those boundaries. And I completely agree as well. This immediate gratification thing is just poisoning. I think a lot of people in general, but kids, this getting things immediately and feeling that sensation of pleasure and gratitude over receiving that, and then expecting it, and creating this sort of almost entitlement behind, I should get this, or I will get this. And it really, I've seen crazy tantrums behind that have come from those types of relationships and those types of desires. And so many things in there that I completely agree with, and those things won't change overnight. And like I mentioned earlier, they won't change by simply giving someone an omega-3 supplement. You're not going to change someone's relationship by a pill or a supplement, and those take work. And I'm grateful that you're at least starting to plant those seeds in parents. And we can't be there in the home as clinicians, but planting those seeds and how to interact, how they can support their children and create those boundaries. And I feel like that's the future for our nation. Has got to be really supporting our youth through nurturing those relationships. So we've already taken a lot of time today, and I do want to honor your busy schedule, knowing too that we'll have you back to talk about more of these topics, because we just scratched the surface really with kind of ADHD. But I do want to give you this time now to, let people know a little bit more about your practice and your work and how they can follow you, because as I mentioned in the introduction, you have so much nourishing educational content that would just go to waste if people aren't aware of it.
Yeah, so and there's a little story behind this too. I mean, I opened my practice here in Missoula, Montana, almost 6 years ago now. And my practice is called Montana Whole Health. And I started blogging at mtwholehealth.com. And the reason I started my Naturopathic Pediatrics blog is because I had so many people from across the country and across the world on my site. And I started getting a little bit worried that, I'm getting people calling my office who are from, I don't know, from like New Zealand or some crazy place. I'm like, this is like supposed to be for, if you're in Missoula to come see me. So I can only see people physically in my office, which, there's in certain states, we have legal requirements of seeing people. We actually have to physically see them in your office before you can do like a Skype or a phone visit. And that's different in different states. So because of all of that, I pushed my blogging over to naturopathicpediatrics.com. And that was, 3 years ago or so now. And I've got about a dozen other naturopathic physicians who all specialize in pediatrics writing other articles there for me as well. So I tried to find people from across the country and a couple in Canada as well. There are not a lot of us. There's only 5,000 naturopathic physicians in the US and Canada anyways. So there's maybe only a couple hundred of us that really specialize so intensely in pediatrics. But there's a huge demand for it. So it's hard to find good naturopathic physicians who do peds. So there are some of us listed on that website if you want to try to find one near you. There's also more listed at pedamp, pedamp.org. So that's the Pediatric Association of Naturopathic Physicians website. And they are all listed by state as well if anybody needs to find a pediatric naturopathic physician. So we've got lots of articles up. There's a search box too. So if your kiddo has a condition and you feel like you want a natural, some kind of natural alternative, we usually have articles. Again, they're usually not like, do this if, XYZ is happening, because that's not how we treat patients. It's more of, here's what we're looking for. But it can be pretty helpful for families. And we've got some ebooks and my new Vaccines Demystified course that it took forever to work on. So that's just unbiased information about vaccines for anybody who's interested. So that's what we've got there.
Yes, and for everyone listening, please check out some of these resources. There are well child guides for each stage, articles at all stages of pregnancy and supporting breastfeeding, and previously mentioned with ADHD, and guides for helping with constipation. There's just so many articles there. I realistically, I haven't found any other site that's provided the degree of educational content that you guys create. And so I really encourage people to check this out and see how you can better support your children, or give some resources to a friend. There's just so much there, and everything is very reasonable in terms of cost. I mean, goodness, like to me, our children have no price tag and should never have a price tag. So all of these resources can be incredibly valuable. So please check them out. And I think for me too, anyone listening and hearing, to me, I think it's sad that there only are probably hundreds, a few hundred, as you mentioned, naturopathic doctors practicing and focusing on pediatrics. And my hope through this conversation and through our future conversations is to show people, well, maybe we won't turn you from an allopath into a naturopath. And realistically, if you didn't go to naturopathic medical school, you probably shouldn't be. But as an allopath, you can learn to use allopathic medicines naturopathically. And that's what Dr. Krumbeck provides on her website. And that's why I'm so grateful to have met you. And perhaps that's our next step. Just as we can negotiate on how to eat macaroni and cheese, maybe we can, start by using allopathic drugs, but doing them from a naturopathic approach. So with that, I'd like to let you have the final words or share any final stories for our audience before we go.
I just want to say thanks. I'm happy you're doing this, and I love building these bridges. I mean, I think it's super important because conventional physicians have their role, and I'm so happy to have, my conventional colleagues in town that I can refer to too. We should be working together, and I think that patients are just going to get better and better if we can keep these lines of communication open and really have these great conversations with each other. So thanks for doing this.
Well, until our next conversation, I hope dinner goes a little bit better this evening for you and your 2-year-old.
Tomato soup, man. That guy, he won't eat a single fruit, but he'll eat tomato soup with his fist. So that'll be cool.
Oh my goodness, I love it. Well, thank you again, and I'll talk to you later.
Sounds good. Take care.
Thank you for your presence and willingness to receive a new narrative, a passionate perspective, and perhaps a deeper sense of connection with our collective purpose. Please share this podcast with any and all that you believe will benefit from its intention to relieve one's doing and engage one's being. Please share your comments about the conversation on our podcast page and leave a review in iTunes so that the voices in this space can spread to all ears ready to receive it. Music credit goes to Dillingham for their song Vessel. Remain open, stay curious, and forever be love.
You walked on fire, and I know you tried.